In this video, you will learn how to prepare a first aid kit with everything necessary to administer first aid to an injured person. Antiseptic to disinfect wounds. Adhesive dressings of different sizes for minor wounds. Latex gloves to avoid contact with the casualty's blood. Sterile gauze pads to cover wounds. A roll of bandage to keep the gauze pads in place. Some scissors to cut gauze, bandages and dressings. A triangular bandage for an arm sling. A hemostatic dressing to stop bleeding. A survival blanket to keep the casualty warm. Some eye wash solution to rinse the eyes. Some burn gel. Pain relief. Your personal medication. And a cold pack. You should also include a sheet listing the items in the kit and their expiry date, as well as emergency telephone numbers such as the emergency services and poison control centers.
Ten first aid mistakes explained by a professional. When someone's in danger, of course, people rush to help. But even if these good Samaritans mean well and are being very brave and selfless, they can end up putting the victim in even more danger if they don't know how to properly administer first aid. That's why it's crucial to avoid these 10 common and very dangerous mistakes and learn what you should do instead. Be sure to Number 10. Tilting your head back during a nosebleed. Nosebleeds can be common since there's so many blood vessels in the nose that are highly sensitive to things like dry air and, well, fingers. There are some situations where nosebleeds are caused by an underlying health issue, in which case you'd need to seek advice from a medical professional. No matter what the reason, we've all been told to tilt our head back whenever we have a nosebleed. But it's high time to ditch this old habit. Tilting your head back can make the blood travel from your nose to your throat, which means you could find yourself choking on or swallowing blood. The best thing to do instead is to apply steady pressure to the bridge of your nose for at least 20 minutes. You'll have to breathe through your mouth this whole time, but you'll safely stop the bleeding. Number 9. Forcing a fainted person to sit up. When someone faints, our immediate course of action is to try to sit them up, especially when shaking them doesn't seem to be helping. Instead of all that, always start by checking their breathing and pulse. If that's all good, leave them on the ground, but raise their legs about 12 inches off the floor. Loosen any restrictive clothing as well. Once they regain consciousness, don't rush to help them back up, as this can just cause them to faint again. Number 8. Putting heat on a sprain or fracture. Ice should be used for acute situations, like suddenly spraining your ankle. Heat is for chronic conditions, like back pain. Heat on a sprain or fracture only increases blood flow and leads to more swelling. The way to go for these types of injuries is always to ice it at first. The ice will help reduce any swelling, bruising, and muscle spasms. Never place an ice pack directly on your skin, and be sure to leave it on for at least 20 minutes. Number 7. Trying to remove debris from your body. If you step on some glass, for example, your gut reaction will be to pull those shards out of your skin yourself. But if the tool you use isn't sterile, or if you underestimate how deep the wound is, you risk getting an infection and doing further damage. so make sure you're using a clean, sterile tool or leave it in the hands of professionals. When it comes to debris in your eye, it's best to close your eye, put a piece of gauze over it, and head to the hospital. Number 6. Treating a burn too quickly. The first step to treating a burn is to run it under cool water, but a common mistake is to just do it for a few seconds or a couple of minutes tops. If the water is to actually help the skin, you need to hold the burn under it for at least 20 minutes. The heat from the burn can go deep across several layers of skin, so even if your skin is cool on the surface, the heat can still be trapped underneath, which is why you need to expose it to cool water for such a long time. Number 5. Going straight into the Heimlich maneuver for choking victims. The Red Cross has updated their guidelines on how to give first aid to choking victims. So instead of going straight for the Heimlich maneuver, here's what you're supposed to do instead. Stand behind the victim, lean them forward, and give their back 5 quick blows with the heel of your hand. Only if that doesn't work at first can you follow it up with the Heimlich maneuver. Administer 5 quick abdominal thrusts and keep doing it until the airway is unobstructed. Number 4. Putting something in a seizing person's mouth. In a panic-induced state at seeing someone having a seizure, a lot of people immediately try to block the person's mouth for fear of the victim biting their own tongue. This is actually dangerous for the victim and for the person trying to help. Another mistake is trying to restrain the person's movements. The thing to do instead is to turn the person over onto their side, which will help them breathe easier. Also, clear out the area of any dangerous objects the victim could hurt themselves on. Most seizures only last no more than 5 minutes, so you have to stay calm. If it goes past that, however, it's time to call for help. Number 3. Prioritizing mouth-to-mouth resuscitation for heart attack victims. When it comes to cardiac conditions like a heart attack, the first step is to always dial emergency medical services. Then administer chest compressions or CPR. According to the American Heart Association, CPR can double or even triple the chances of someone's survival. Even if the victim isn't breathing and there isn't a heartbeat, the body has enough oxygen that you can help it circulate thanks to CPR. A common mistake is to think that mouth-to-mouth resuscitation is more important than chest compressions. But that's not the case according to the guidelines for CPR set by the American Heart Association. So, now you know that if a person near you collapses from a cardiac condition, focus on chest compressions and don't go near their face. Number 2. Not knowing what you're doing. Again, good Samaritans mean well when it comes to helping someone in an emergency situation. But if you don't know how to, for instance, administer CPR or the Heimlich maneuver correctly, you can end up doing more harm than good. For example, someone might try to give CPR and forget that you have to tilt the victim's head back to keep the airway open. That can be a very dangerous blunder. That's why the first line of action in all serious first aid situations is to call for help and let a professional guide you through what you need to do. Number 1. Using a tourniquet for a bleeding wound. Yes, tourniquets can stop a person from bleeding, but it's not a fix-all solution for any type of wound. If someone has a deep wound in their arm or leg, applying a tourniquet can stop the blood flow to the entire limb, which can actually starve the tissues of oxygen and possibly lead to amputation. Using a tourniquet should never be the first choice. You know by now that your first course of action should be to call for an ambulance. While they're on their way, apply downward pressure with your hands onto a major wound that's bleeding out. If you have sterile gauze, then use it so that you don't transfer bacteria from your hands to the wound. This method can even stop bleeding from a large vein or artery. Once the bleeding has stopped, wrap the wound securely with gauze. Only use a tourniquet if, after all this, there's still uncontrolled bleeding. But by this time, the paramedics should be close.
Hello! In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC. And if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally. Why not take a training course to practice these steps? Share this video with friends and family to make sure we all know what to do. Health sketch. Health for all to see.
In this video, you will learn to administer first aid to a person over the age of 1 who is choking. There are 3 possible scenarios. Scenario 1. The casualty is breathing, but with difficulty. Encourage the person to cough and don't do anything else. Coughing is the most effective way of dislodging an object. Doing anything else could worsen the situation. Scenario 2. The casualty is not breathing, but is still conscious. Support their upper body with one hand and lean them forward. Give them up to 5 sharp back blows between their shoulder blades with the heel of your hand. If the back blows don't work, alternate with a series of 5 abdominal thrusts. Place your hand clenched in a fist in the middle of the abdomen just below the sternum, in the hollow of their stomach. Place your other hand over it. Bend the casualty forward. Pull sharply inwards and upwards. Alternate 5 back blows with 5 abdominal thrusts until the casualty is breathing normally. Scenario 3. None of these procedures has worked and the casualty loses consciousness. Call or get someone to call the emergency services and start cardiopulmonary resuscitation. Alternating 30 chest compressions with 2 rescue breaths. If you don't know how to give mouth-to-mouth breathing, do chest compressions only, at a rate of 2 per second. Continue CPR until medical help arrives or the casualty starts breathing normally. If the choking person is obese or pregnant and you're unable to grasp your hands around them to perform abdominal thrusts, you can alternate back blows with chest thrusts.